Good morning, Walla Walla. This is Dr. Kaminsky from the Walla Walla Department of Community Health. Today is September 3rd, 2021. We spoke with you on Monday at the Board of Health meeting, and this is just the end of the week COVID update. When we spoke on Monday, we did note that the nationwide community transmission rate of COVID was in the high category for 93% of the country. The previous week, 87% of the country had a high level transmission. This week, it has edged up a little bit more to 94%. And so we're seeing cases rise all throughout the country. As we mentioned on Monday, Nebraska is not reporting countywide data for other counties. With regards to cases, this is just another graphic showing that cases are rising. We did mention on Monday that the rate of case rate rise is starting to slow down a little bit, but we're still at about a 3% increase in case rate per week. This is a 7-day moving average. We've been talking about the hospitalization rate nationwide and local, and that has been our biggest concern. And that was the original reason for the mantra, flatten the curve, is that we didn't want the hospital system to get overwhelmed. And as this graph shows, we're seeing a uptick in hospitalizations due to COVID. We're not quite reaching the peak that we saw nationwide during the winter time, and it looks like this nationwide peak is starting to flatten a little bit. But as you may recall from Monday, we did mention that hospitalizations are the highest that they have been since the start of this pandemic in those aged 50 and younger. So this is causing hospitalizations in a lot younger cohort. Also, as you may recall, we're one of several states who where our hospitalization rate has exceeded what we experienced early in the pandemic. So this Oregon, Washington, and other states, we're seeing the highest rates we've ever seen with regards to hospitalizations, even though the nationwide hospital rate is not quite as high. With regards to the case rate, this is the by state. This was the case rate reported on Monday per 100,000. And this site, which was the Washington Recovery Dashboard through the governor's office, this site has been decommissioned. And so we will be using this graph from Department of Health, which basically has the same data. When we spoke on Monday, the 14-day case rate for the state was 534. Now at the end of the week, it is 566. And as we mentioned on Monday, we have a new peak in case rate throughout the state. With regards to Walla Walla, we've continued to show an upward trend in cases. Our case rate curve has not been as steep as other counties. We did mention on Monday that our internal numbers show a lot higher case rate. We are exceeding 800 cases per 100,000 over 2 weeks. These Department of Health websites, they do have a lag in data. This was the slide we showed on Monday, and as of Friday, as you can see, the case rate has gone up. Looking at the ranking of case rates, we now rank 17th out of the state for case rate, but we are still at an extremely high level. But one of the main messages here is that everywhere around us, the case rates are going up, and case rates do extrapolate to increased hospitalizations, and that is our biggest concern. This is from our county website, and this is data as of yesterday morning. You can see that the number of hospitalized people is 18, and of those 16 are unvaccinated. The number of total ICU admissions is 4, and out of these, none of them are vaccinated, and there's one person that was on the ventilator, and they were unvaccinated. If you look at county, as far as the census, most of these are from Walla Walla County, but we do have some patients from outside the region because of our referral pattern. And so, once again, this is a pandemic of the unvaccinated at this point. Based on that data from that one slide, we can see that about 90% of the admissions with COVID are those who are not fully vaccinated. 100% of the current ICU admissions on that day were unvaccinated, and 100% of the patients on the ventilator were not vaccinated. Just reinforcing the benefit of getting vaccinated and decreasing the risk of hospitalization and severe illness and death. So, as we mentioned on Monday, we're encouraging people to get vaccinated. We do have several events today, and those you can see on our website where they are located. This includes the Southgate Clinic. We also have vaccines available at the fairgrounds, and just a reminder that booster shots are not available quite yet for the general population. An additional dose is only available for those with an immunocompromised state, and you'll want to talk to your physician about whether or not you qualify for that. But I want to reiterate the fact that vaccines are safe and effective and currently free. Also want to discuss the importance of masking. And on our previous talks, we talk about the infectivity of this Delta variant, and wearing masks decrease spread. Decreased spread means decreased cases, which means decreased hospitalizations. Likewise, the importance of social distancing helps decrease the rate of spread, and also wash your hands frequently. And so we're now day 3 of the fair, and just want to remind everyone to be safe, mask up, socially distance, and wash your hands. And hope you all have a good weekend, and take care of yourselves and take care of each other. Thank you.